I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Great show today. You're really going to enjoy this one. This is definitely an adult show. We're going to be talking about the food-romance connection. We're going to talk about how food affects your love life and supplements and things that you're doing that are adversely affecting your love life and perhaps enhancing your love life. So we got a lot of good information. If you have children, again, this is not a children's show. This is probably the only time of the year I'm going to tell you, turn the radio off, turn to whatever you're watching this on, shut it off, because this is definitely an adult theme show. I'm going to be clean. I'm not going to get mean or dirty, but it may not be something that you want your kids to hear. Now, if you want your kids to hear it, it's fine. I'm going to be very scientific about it. So what we want to talk about today, again, is what's happening. Because if you ever watch a sporting event, like every third commercial is for a little blue pill, and even on radio, there's commercials constantly, you know, this can help you, this can help you. Now, here's the thing. As you get older, your love life changes. And I want you to understand this, that you're not less a man, less a woman, because as you get older, things change. Your testosterone levels drop. Now, testosterone does a lot of things. One of them is it helps with your love life. Women, their estrogen levels drop. And as estrogen drops, there may be issues with lubrication. There may be issues with pain, comfort, ability to experience pleasure. So it happens. And in the big scheme of things, as you get older, you're kind of past your prime. You're not of childbearing years anymore. Men can be, but probably shouldn't be. And so nature says, we don't really need you to have this function anymore. And so there are things we can do to fight that, and the things we can do to help reverse that. And a lot of it can be proactive. I'll talk about proactive things you can do, supplements and treatments that work really well for men and women. But I'm going to talk about the things that you need to do to stop poisoning yourself. Stop affecting your love life in an adverse way. So let's take a little trip here. Let's assume that you're going to go out on a romantic dinner. And whatever the occasion is, could be Valentine's Day, it could be a birthday, anniversary, whatever it is. You want to go out to a romantic dinner with the intent of it being a romantic evening. Not just dinner, but a whole romantic evening. So traditionally, if you watch TV, if what Hollywood would tell you, if we're going to go out to a romantic dinner, we're going to go out to a steakhouse, very fancy restaurant. And you're going to have waiters in tuxedos. And there's a certain menu that oftentimes is associated with a romantic dinner. So it might include, well, certainly wine. You have to have wine, red wine, of course, right? Steak, maybe baked potato and butter, sour cream, cheesecake, lobster, coffee, dessert, maybe a chocolate dessert or something sweet, of course, would go in there. And so that would be considered, many people would consider that a very romantic dinner. And it sounds very nice. And it probably would be a romantic dinner if it wasn't for the food. All the things I just listed have an adverse effect on your love life. And we're going to break it down step by step on what happens when you put these different foods in your body and why it's not working. Then we're going to talk about other reasons why your love life may not be working too. So a lot of good information. So I can't really chop this show up. This show is kind of be one long stream of thought here. So let's start out with a romantic dinner. So we're going to go out to a romantic dinner, whoever we are. And first thing you're going to do, the waiter will come by, kind of get you something to drink. And what's the first thing you're probably going to say? Yes, I'd like to have a glass of wine, I'd like to have a drink, whatever it is. And the alcohol comes. Now, the alcohol, when it comes to romance, could be a good thing because it kind of loosens you up, breaks down your inhibitions, get a little crazy. But the problem is that alcohol also reduces your testosterone levels. Alcohol will lower testosterone. Now, testosterone, you think of it as a sex drive hormone, but it's also for muscles. You build up your biceps, your triceps. Testosterone does that. However, what about your heart? Your heart's a muscle. What about your colon? Your colon's a muscle. Your blood vessels. So all of these are muscles. So you need testosterone in order for the body to work normally and function the best it can. As we get older, for men and women, testosterone levels start to drop. It's part of the aging process. It is what it is. Now, there are things you can do to fight that, but it's going to happen. It's inevitable, okay? So testosterone is dropping anyway, and now you're drinking alcohol. Alcohol drops your testosterone even further. It can, like I said, help you. It does relax you, lowers your inhibition, so you might get a little more adventurous or frisky. But alcohol is also a diuretic. Diuretic is what? Makes you pee. I know my same joke I always use. You ever notice how you drink one beer, you pee out 3? Where those other 2 beers come from? Your body, when alcohol gets into the body flushes alcohol out of the system. And the chemical process is pretty neat. There's a chemical in your brain called antidiuretic hormone, or vasopressin. And antidiuretic hormone prevents you from just peeing all day. So in a healthy body, the antidiuretic hormone allows you to hold on to fluid and then eventually, pee when you have to. Alcohol lowers your antidiuretic hormone, also known as vasopressin, and so you pee more. Why is that? Your body is trying to get the alcohol out of the system because alcohol can destroy brain cells. Your brain controls what? Everything. So you're drinking alcohol, you're peeing a lot, it's a diuretic. What does that have to do with romance? Well, you need good blood flow, men and women, in order to obtain, maintain, and achieve a pleasurable response. You need blood flow. If you're peeing a lot of it out, your blood volume drops. And as your blood volume drops, you don't have as much blood. And so the circulation isn't as good. So alcohol does multiple things to adversely affect your love life. The pro is that it makes you a little, uninhibited. The con is you may not be able to do anything about it because you can't function, men and women. So not a good choice. And also it's a lot of sugar, and sugar weakens the immune system. So alcohol for multiple reasons, the alcohol itself, the diuretic effect, and the sugar, not good. Now, there are some health benefits to alcohol, which I have put in quotes there, because it does have some nutrients in it. But the nutrients don't come from the alcohol, they come from the grapes. So instead of having wine to start out your romantic evening, maybe just have a little fruit tray with some grapes in it. And then you have the antioxidants and the proanthocyanidins and everything else that's going to be found in a good, healthy diet without the toxic chemicals. Make sure you do organic because grapes have a lot of pesticides in them. And pesticides can kill off bacteria in your body and also affect your hormones. They act as an endocrine disruptor. So if the wine has pesticides in it, which most does unless it's organic, you're going to have an adverse effect there as well. Okay, so alcohol, not a good idea. So you start out with alcohol already. You're on the road to ruin. Then you order your main course. And let's assume you have something like steak and lobster. Let's go all out. Steak and lobster. Steak is a very heavy protein. The number one consumer of energy we have as humans is romance. Keep it clean. The number 2 consumer of energy we have is digestion. The hardest thing to digest is animal proteins. And the hardest animal protein to digest would be flesh, like steak. So you're going to have a steak, you're using up a ton of energy to try to break down this steak. Your body only needs about 8 to 10% of its total caloric intake as protein. Anything beyond that is wasted and puts a lot of strain on your liver and your kidneys. So if you have liver disease or propensity, or if you have kidney problems, I see a lot of patients with kidney disease, eating animal protein is one of the worst things you can do. It's so hard to do. So it's giving too much protein, robbing the body of energy, putting stress on the liver and the kidneys. Many times, if you're eating commercial animal products, they have estrogen. The animals are giving growth hormones to make them bigger. Why is that? We sell meat by the pound. And so the bigger we can make them, the more money we're going to make. But those estrogen compounds that they give these animals, when you put them in your body, counteracts testosterone. So now you're fighting, your testosterone is already lower from the alcohol. If you're getting older, it's lower anyway. And now we're putting animal protein in the body, which is now robbing the body of more energy. Not a good idea. And it probably has estrogen in it, which is going to counteract testosterone. It's also loaded with saturated fat. Saturated fat can clump your red blood cells together. And when red blood cells come together, they clump together, they can't carry oxygen. So now you're going to get tired and you're going to affect circulation. Remember, when it comes to romance, a lot of it has to do with circulation. So we're going to have a problem there. And we talked about the hormones, the antibiotics, the pesticides, the herbicides. That's a big issue. And the meat, when it gets in your gut, can rot. Again, it's hard to digest, and so many patients. Again, I've been doing this now for 36 years, not counting my education. I've been in practice 36 years. What I see is people many times have bad breath. And I say there's always two types of bad breath. One of them is a rotten tooth or an infected tooth, and that has a certain smell to it. But if somebody's breath smells like an outhouse, you know what I'm talking about. The food is rotten in their colon. So it's a colon issue, not a breath issue. You can brush and floss and whatever you want to do, mouthwash, it's coming from the colon. And the gases in the colon are being released into the blood system. The blood then carries these gases to the lungs where the air is, again, exchanged in the lungs, and it comes out as that potty breath. So if you have somebody with rotten breath, chances are it's a colon issue. And if you're eating meat, many times the meat will rot in the colon, and that will cause that foul breath. Now, when it comes to romance, foul breath can kind of put a damper on things. Okay? So not a good idea for that reason. Also, when you put calcium, when you put acid in your body, like meat, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, the 7 deadly sins, when you put that in your body, it's an acid. The body has to neutralize that acid, and the body uses calcium as its primary neutralizing agent. So the body is sucking calcium out of the blood, out of the bones, to neutralize the acids. Well, you need calcium. Calcium helps you relax. And so if you're using up your calcium, you may not get into that relaxed state. Romance is a parasympathetic function. There's 2 types of nerves in your body. Sympathetic speed you up, parasympathetic slow you down. Romance is a parasympathetic function. You need to be relaxed. If you're stressed out, for men and women, not going to work real well. So you need that calcium to help you relax. The acid is robbing the body of calcium. Another reason why eating animal proteins is not a good idea when it comes to romance. So that steak is really just off the chart bad for you. Now, if you're doing lobster, I always joke about this, lobster is a cousin to the cockroach. I mean, you ever turn a cockroach upside down, a lobster upside down? They kind of look pretty much the same. So they are scavengers. They live on the bottom and they eat junk. And even when Moses wrote Leviticus, way back when, Moses wrote Leviticus, and Moses said very clearly, don't eat shellfish. That's when the water was clean. Imagine now with the water so dirty. So lobster, as far as I know, 100% of the time, is loaded with heavy metals like mercury. Mercury, when it gets into the body, can essentially short-circuit your nervous system. So we want to stay away from lobster if we can at all costs, and it's loaded with saturated fat and cholesterol. Cholesterol can gunk up your liver, can clog up your arteries. Not a good idea. And then you dip it in butter, which is another saturated fat. And unless it's organic butter, even if it is organic butter, it probably has some estrogen in it because cows produce these estrogen-like compounds to feed the baby cows to make them grow. It's a growth hormone. If you're eating commercial butter, chances are it even has extra hormones in it, which can have an adverse effect on your testosterone. And these things can cause you to gain weight. And if you're fat, and I used to be fat, I can say the F word, fat produces estrogen. Estrogen causes you to lay down fat, which produces estrogen, which causes you to lay down fat. So when you're fat, it's hard to lose weight because you're producing more estrogen, causing you to gain weight. So that's why women have a harder time losing weight than men in most cases because they're estrogen dominant. Men are testosterone dominant. It's what it is. It's the way nature made us. So eating an animal protein is not a good idea for so many different levels. Today we're talking about why it's not good for romance. And we're talking about the food-romance connection, how food affects your love life. So steak, not a good idea. Alcohol, not a good idea. How about a baked potato? Okay, I'm going to give you a sort of okay on this one. Potatoes are complex carbohydrates, a good source of energy, and potatoes can increase your serotonin levels in your brain. Serotonin helps you relax. So there's a plus for the baked potato. If you're going to eat a potato, make sure it's normal size. I've been to steakhouses before. I get invited out all the time for dinner, and people want to impress me, so they take me to a steakhouse. You're not impressing me taking me to a steakhouse, okay? You're impressing me taking to a strip mall Chinese place and get me some, Chinese eggplant. That'll impress me. But I go to these steakhouses, and many times I just order vegetables because I don't eat animal proteins. And I've seen some of these potatoes that are like 2-pound potatoes. You've probably seen these things like a little child. Those are not normal. They have to be enhanced to grow. Now, I don't know what's in these potatoes, but I'll eat it if it's the only thing there, but I'm thinking it's probably not the best thing for me. It's not the way a potato appears in nature. But now you start putting butter and sour cream on that potato. Not a good idea, because the fats can clog up your arteries, and they're high in estrogens. We talked about that, and that's an antagonist to testosterone. And testosterone is made in your adrenal glands and also in your gonads. So the adrenal glands, we abuse the heck out of our adrenal glands every day. We do stimulants. We do coffee, tea, chocolate, cigarettes, stress. This puts stress on the adrenal glands, which can now lower our body's ability to produce something called androgens. Androgens are male hormones, testosterone being one of them. So we're beating up our adrenal glands, and then we're doing things like coffee or alcohol or meat, more stress on the adrenal glands. And so we want to keep those adrenal glands healthy. One of the supplements I take every day, and I'll talk about supplements. I guess I could talk about them now. I take a series of supplements every day. One of them, one reason is to make sure my testosterone levels stay high. Because as you get older, testosterone is dropping. I mean, like I said, it is what it is. But what can we do about it? I take Dr. Joe's Adrenal Support. The adrenal support keeps my adrenal glands working, helps fight the aging process. The minimum supplements you should take every day are Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. It's prebiotics, probiotics, digestive enzymes, a complete multivitamin. It alkalizes the system so we don't be robbing calcium from the bones and the blood. So I take Super Greens and Essential Source for many reasons. Adrenal support for energy, hormone levels, and inflammation. The key supplement when it comes to romance is something called nitric oxide. Nitric oxide opens up your blood vessels and increases circulation. So there's little blue pills that are the medicine version of that. So that's nitric oxide like on steroids. The danger of that is sometimes it's too much of a vasodilation with those little blue pills. The nitric oxide, I take it every day. Number one, good for circulation, not only for romance, but for brain function. For heart, my lungs, my arms, my legs, I want to have good circulation because as you get older, your nitric oxide levels drop. It also gives you a ton of energy. So people ask me all the time, where do you get your energy from? A, I don't eat bad foods. B, I do eat good foods. And C, I take supplements that actually help me out as well, like nitric oxide. So adrenal support, nitric oxide, great for romance. B vitamins, very important for nerve function. You have to have nerve function and you have to have blood supply in order for the romantic parts to work. And so I take B vitamins as well. Now, I take other supplements as well. I take omega-3 fatty acids, which you have to get them from an outside source. They're called essential because you can't make them yourself. I take an omega-3 fatty acid. If I eat a cooked meal, I take Dr. Joe's digestive enzymes. Helps digest my food. Because why? As I'm getting older, my digestive enzyme levels are dropping. A lot of things droop and drop when you get older, don't they? So you can take supplements to work on that. Vitamin D is very important, too, to keep your immune system strong. Because, again, assuming if you're in a monogamous relationship, that's good. But you also want to stay healthy. And if there's a chance of getting a disease, you want to do everything you can to boost your immune system. And vitamin D is key to that. And then I take glutathione as well, which is it helps the liver. And it's an antioxidant, so I take that as well. So I take a handful of supplements actually every day, but I couldn't imagine not taking them. There's a few more too. I won't drag that out too much. Now, if you do want all of the supplements I talk about, folks, they're on my website, drjoe.com, drjoe.com. And if you go to, it's a store page, it's called. We have all the supplements listed there. But again, for romance, nitric oxide is going to be a key. Adrenal support is going to be a key. Super Greens and Essential Source. Now, you're not going to take it like a little blue pill and go, dun, 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 I'm Superman. No, that's not going to happen. It takes time to build up these depleted levels in your body. And that's one of the differences with supplements versus drugs. Drugs, boom, usually a pretty quick effect. A lot of side effects. Supplements, very few side effects, but it takes time to rebuild those stores. So don't think you're going to take this tonight and go, ha-ha, I'm 16 again. No, you're not. It's not going to happen. It does take time. The other thing I want to make sure I cover is we said circulation is important, but so is nerve supply. So I've seen a lot of cases in my career, thousands of them. Men and women, you have a pinched nerve in the low back. So you have a pinched nerve in the low back, that might cause back pain, leg pain, hip pain, knee pain, ankle pain. But that same nerve controls your colon, your sex organs, your bladder. So now you might see gas, bloating, diarrhea, constipation, sexual dysfunction for men and women. The nerve in the low back controls those organs. And so many times we have to adjust them, chiropractic manipulations, to put the bones back in place to open up the nerve supply to the organs. Then we get people off their bad diet, the things that are adversely affecting their love life. Then we get them on supplements, and in most cases, not all, but in most cases, amazing results. If we need to escalate care, in our office, we have a treatment called PRP. PRP is called platelet-rich plasma. We take your blood, we spin it down, we take out the growth factors, the platelets. We can re-inject them into an arthritic joint to help stimulate new growth and reduce inflammation. You can do it in your hair to stimulate new hair growth, but we also can do a P shot and an O shot. P for men, O for women. And the P shot, we can actually take the PRP and inject it back into the male organ. Now, it doesn't hurt. It's all numbed up and everything. And that can stimulate new growth, kind of refreshing the cells in that area. So it's a natural approach to trying to deal with male dysfunction when it comes to romance. And it's your own cells. It's not a drug. It's not cells from a baby's umbilical cord somewhere that's been shipped out and processed. It's your own cells. And the effect then is long-term, as opposed to a little blue pill. Instant effects, but maybe very severe side effects. For an O shot, women that maybe can't reach orgasm, women that maybe cough or sneeze and pee a little bit when they do that, the muscles and the organs just aren't working like they're supposed to down there. And so the O shot can be the same thing. Take your own cells and put it back into the body. Tightens things up. Many times women are able to experience pleasure or higher levels of pleasure. So we have that available as well. And on our website, drjoe.com, if you go to our drop-down menu, we have tons and tons of services that we offer. We'd love to be your doctors. So if you have neck pain, back pain, shoulder pain, if you've ever been in a car accident, if the car was damaged, you were damaged. I don't care if you have pain or not. I want you to come see us right away. Let us check you out. If there's nothing wrong, you know what? There's nothing wrong. Go home. But if there is something wrong, which it probably is, you want to get that treated before the pain even shows up. So if you have any questions, send them to me through the website, drjoe.com, or better yet, just make an appointment, drjoe.com. I'm Dr. Joe Esposito. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.